What if you could heal foot pain without surgery or injections? If you're dealing with chronic heel pain or foot pain that just won't go away, I have some exciting news for you. My name is Dr. Andrew Schneider and I'm a podiatrist in Houston, Texas. I know the frustration you're feeling. You've tried rest, stretching, inserts, maybe even cortisone injections, but the pain keeps coming back. You're tired of limping around, tired of missing activities you love, and you probably are wondering if surgery is your only option. Today, I want to tell you about a treatment that's changing how we approach chronic foot pain. It's called shockwave therapy, and in many cases, it can stop chronic heel pain in just 3 treatments: no surgery, no injections, and no lengthy recovery time. In today's video, I'm going to explain exactly what shockwave therapy is, how it works, and the conditions it can treat, and what you can expect during and after this treatment. I'll also share why this might be the missing piece in your foot pain recovery. Before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Let me start by clearing up the biggest misconception about shockwave therapy. When people hear the word shockwave, they often think it's some sort of electrical shock treatment, and that's not what this is at all. Shockwave therapy uses acoustic waves, sound waves, not electric shocks. These are high-energy sound waves that penetrate into your tissue to stimulate healing. It's completely different from electrical stimulation or any kind of shock treatment. The technical name is extracorporeal shockwave therapy, or ESWT. Extracorporeal means outside the body. We're delivering these acoustic waves from outside your body into the injured tissue inside. Here's how the treatment actually works. We have a specialized device that generates these acoustic waves. The device has a handpiece that we place against your skin over the area of pain. The waves penetrate through your skin and into the deeper tissue where the problem is located. What happens during treatment is fascinating. The shock waves create what we call controlled microtrauma. Now that might sound scary, but it's actually a good thing. This controlled microtrauma stimulates your body's natural healing response in areas where healing has stalled. Think about it this way. When you have chronic pain, especially something like plantar fasciitis that's been going on for months or years, your body's healing process has essentially gotten stuck. The tissue isn't inflamed anymore. It's just damaged and not repairing itself. Shockwave therapy essentially restarts that healing process. It's like giving your body a wake-up call to start repairing the damaged tissue again. Here's what happens inside your tissue when we first apply shockwave therapy. First, it increases blood flow to the area. Better blood flow means more oxygen and nutrients getting to the damaged tissue, which is essential for healing. Second, it promotes collagen production. Collagen is the building block of tendons, ligaments, and fascia. When these tissues are damaged, you need new collagen to repair them properly. Third, it breaks up scar tissue and calcifications. Over time, chronic injuries can develop scar tissue or calcium deposits that interfere with normal function. The shock waves help to break these up so the tissue can move again and function normally again. Fourth, it reduces chronic inflammation. This isn't the acute inflammation that you get right after an injury that's actually helpful. This is the chronic, low-grade inflammation that can persist for months or years and actually interferes with healing. Finally, and this is important, shockwave therapy stimulates the release of growth factors and stem cell activity. These are your body's natural repair mechanisms, and shockwave therapy helps activate them in the specific area where you need healing. Now, why does this matter for chronic foot pain? Because chronic foot pain often represents a situation where your body's healing process is stalled. You're not dealing with acute inflammation anymore. You're dealing with tissue that's damaged but not repairing itself. Traditional treatments like rest, ice, and anti-inflammatory medications are designed for acute injuries. They don't address the underlying problems when healing is stopped. That's why you can rest for weeks or months and still have pain when you return to activity. Shockwave therapy addresses this by restarting the healing process at the cellular level. Let me tell you about the conditions that respond particularly well to shockwave therapy. The number one condition is plantar fasciitis, especially chronic plantar fasciitis. It's been going on for more than 6 to 8 weeks. Plantar fasciitis is the most common cause of heel pain, and it's often the condition that responds best to shockwave therapy. Studies show success rates of 70 to 80% with chronic plantar fasciitis with shockwave therapy. Achilles tendonitis is also a condition that responds excellently to shockwave therapy, especially chronic cases where the tendons become thickened and painful. This includes both insertional Achilles tendonitis, where the tendon attaches to the heel bone, and mid-portion Achilles tendonitis. We also use shockwave therapy for other foot and ankle conditions: peroneal tendonitis, which causes pain on the outside of the ankle; posterior tibial tendonitis, which can cause pain on the inside of the ankle and the arch; heel spurs, which are calcium deposits that can form on the heel bone. In some cases, we can even use shockwave therapy for Morton's neuroma, which is the thickening of tissue around the nerves between the toes that cause pain and numbness in the ball of the foot. The key is that these need to be chronic conditions, problems that have been going on for at least 6 weeks and haven't responded well to conservative treatment. So who's a good candidate for shockwave therapy? The ideal patient is someone whose pain has lasted more than 6 to 8 weeks, despite trying conservative treatments. You've tried rest, stretching, maybe physical therapy, possibly orthotics, different shoes, but you're still having significant pain. You're also a good candidate if you want to avoid surgery or injections. Many people are hesitant about cortisone injections, either because they've had them before and they didn't last, or because they're concerned about potential side effects. Shockwave therapy is also ideal for people who want to stay active during treatment. Unlike surgery, there's no lengthy recovery period where you can't walk or exercise. Now, who might not benefit as much from shockwave therapy? If you have an acute injury, something that just happened in the last few weeks, shockwave therapy might be too early. Acute injuries often heal well with basic conservative care, and you don't need to jump to advanced treatments right away. If you have severe structural damage, like a complete tendon rupture or advanced arthritis with significant joint destruction, shockwave therapy may not be enough on its own. There's also certain medical conditions where we need to be cautious. If you have a blood clotting disorder, or on blood thinners, or have certain types of infection in the area, we might need to modify the treatment or consider other options. Pregnant women should avoid shockwave therapy, and we don't typically use it in areas where there are tumors and malignancies. Let me walk you through what to expect during the shockwave therapy treatment. First, you'll come into the office and we'll have you lie or sit comfortably. We'll position your foot so we can easily access the area we need to treat. Use a special ultrasound gel to your skin called a coupling gel, and it helps the shockwaves penetrate into your tissue more effectively and efficiently. It's similar to the gel used for ultrasounds. Then we place the shockwave device against your skin over the area of pain. The treatment itself takes about 10 to 15 minutes. During this time, you'll feel a tapping or pulsing sensation as the shockwaves are delivered to your tissue. Most patients describe the sensation as feeling like someone is tapping on their foot with a small hammer or a woodpecker tapping rapidly. It's not painful, but you definitely feel it. Some areas might be more sensitive than others, especially if there's a lot of scar tissue or calcification. The intensity can be adjusted based on your comfort level. We start at a lower intensity and gradually increase as you get used to the sensation. The goal is to deliver effective treatment while keeping you comfortable. One of the great things about shockwave therapy is that there's no downtime. You can walk out of the office and resume your normal activities immediately. You don't need crutches, you don't need to stay off your feet, and you can drive yourself home. You might experience some temporary soreness after the treatment, similar to the soreness you might feel after a good workout. This usually resolves within 24 to 48 hours and is actually a sign the treatment is working. It means your body's responding to the stimulus and starting the healing process. Now let's talk about the treatment schedule. The typical protocol is once a week for 3 weeks. Some patients need a 4th session, but most see significant improvement after 3 treatments. This is one of the advantages of shockwave therapy. It's a relatively short treatment course compared to other options. Physical therapy might take months. Multiple cortisone injections are spaced months apart. But with shockwave therapy, you're usually done with the active treatment phase in 3 to 4 weeks. However, it's important to understand the timeline for results. Some patients feel relief quickly, sometimes even after the first treatment. But for most people, improvement is gradual over the following weeks and months. This is because shockwave therapy works by stimulating your body's natural healing process, and healing takes time. You're not just masking the pain, you're actually repairing the damaged tissue, and that happens gradually. Most patients start noticing improvement around 3 to 4 weeks after their first treatment. Significant improvement usually occurs after the following 2 to 3 months. The full benefit can take up to 4 to 6 months to realize. Now, I know that sounds like a long time, especially when you're in pain, but remember, we're talking about actually healing the tissue, not just providing temporary relief. Real healing takes time, but the results are typically long-lasting. Let me share some of the research on how effective shockwave therapy actually is. For plantar fasciitis, which is the most studied condition, success rates range from 70 to 80%. That means 7 to 8 out of 10 people with chronic plantar fasciitis see significant improvement with shockwave therapy. What we see clinically in my practice is that many patients avoid surgery entirely. People who were told they needed plantar fascia release surgery or other procedures often find that shockwave therapy gives them the relief they were looking for. The improvement tends to be long-term rather than temporary. Unlike cortisone injections, which might last a few months, the benefit of shockwave therapy often lasts for years. I've had patients tell me that shockwave therapy was the first treatment that actually made a lasting difference in their pain. They've tried everything else: rest, stretching, orthotics, physical therapy, multiple cortisone injections, but nothing provided lasting relief until they tried shockwave therapy. Now let me compare shockwave therapy to other common treatments so you can understand how it fits into your options. Compared to cortisone injections, shockwave therapy works differently. Cortisone provides fast relief by reducing inflammation, but it's temporary, usually lasting a few months at most. Cortisone also doesn't promote healing, it just reduces symptoms. Shockwave therapy is slower to show results, but it promotes actual healing and repair. The benefits tend to last much longer because you're fixing the underlying problem, not just covering up the symptoms. Compared to physical therapy alone, shockwave therapy addresses the tissue repair aspect that physical therapy can't. Physical therapy is excellent for addressing biomechanical issues, improving flexibility, and building strength. Tissue itself is damaged, not healing. Physical therapy alone might not be enough. The ideal approach often combines shockwave therapy with appropriate physical therapy. The shockwave therapy stimulates tissue repair, while physical therapy addresses the mechanical factors that contributed to the problem in the first place. Compared to surgery, shockwave therapy is obviously much less invasive. There's no incision, no anesthesia, no risk of infection or other surgical complications. You can return to normal activities rather than being off your feet for weeks or months. Surgery should always be a last resort for conditions like plantar fasciitis. While surgery can be effective, it carries a risk and requires a significant recovery period. Many patients that are considering surgery find that shockwave therapy gives them the relief they need without having to go under the knife. Let me address some common questions patients ask about shockwave therapy. Does it hurt? The treatment itself is not painful, but you'll feel it. Most patients describe it as a tolerable discomfort rather than pain. We can always adjust the intensity if it becomes too uncomfortable. Is it safe? Shockwave therapy has been an excellent safety profile. It's been used for decades, first for breaking up kidney stones, then for musculoskeletal conditions. There are very few risks, and no one has been made worse by shockwave therapy. How long do the results last? For most patients who respond well to treatment, the results are long-lasting, often years, because we're actually healing the tissue rather than masking symptoms. The improvement tends to be permanent as long as you don't re-injure the area. Is it covered by insurance? Unfortunately, shockwave therapy is often not covered by insurance. It's considered a regenerative treatment, and insurance companies are often slow to cover newer technologies, even when they're proven effective. However, many patients find the cost is reasonable when compared to other ongoing costs of treatments, multiple doctor visits, and the impact of continuing to live with pain. Let me share some common mistakes to avoid if you're considering shockwave therapy. The biggest mistake is expecting instant results. Remember, this treatment works by stimulating your body's natural healing process, and healing takes time. Don't get discouraged if you don't feel dramatically better immediately after your first treatment. Another mistake is not completing the full treatment course. Some patients feel better after 1 or 2 treatments and they think they don't need a third one, but completing the full course gives you the best chance at long-term success. It's also important not to ignore contributing factors during treatment. If you have biomechanical issues, poor footwear, or other factors that contributed to your problem in the first place, these need to be addressed too. Shockwave therapy can heal the tissue, but if you don't address the underlying causes, the problem might come back. So here's my final takeaway about shockwave therapy. If you want real healing, not just symptom relief, and you've tried everything else without lasting success, shockwave therapy may be your missing piece in recovery. The treatment represents a shift from just managing pain to actually healing tissue. It's not a quick fix, but for many patients, it's the solutions they've been looking for. I've been using shockwave therapy in my practice for several years now, and I've seen remarkable results. Patients who were told they needed surgery, people who have been dealing with pain for years, athletes who have thought they'd never get back to their sport, many of them have found lasting relief with shockwave therapy. The technology exists, the research supports it, and the clinical results speak for themselves. If your foot pain won't go away despite trying conservative treatments, it's time to consider a different approach. If you're dealing with chronic heel pain or foot pain that won't go away, don't wait for it to get worse. The longer you wait, the more chronic the condition becomes, and the longer it takes to heal. Schedule a consultation to see if shockwave therapy is right for you. We can evaluate your specific condition, discuss your treatment options, and determine whether you're a good candidate for this treatment. How long have you been dealing with foot pain? Have you tried shockwave therapy before? Let me know in the comments below. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're interested in learning more about shockwave therapy for your foot pain, contact us at the office for a consultation. That link is in the description. Remember, you don't have to live with chronic foot pain. With the right treatment approach, you can get back to the activities you love, pain-free. Thanks so much for watching, and have a great day.